Hello, I'm Dr. Manista with Olympia Orthopedic Associates. I'm an orthopedic surgeon practicing in Olympia, Washington, and I wanted to talk to you about an important but often overlooked cause of lower back pain, and that is the sacroiliac joint. The sacroiliac joint is the junction of the spine and your pelvis. It links the sacrum to the iliac bones. It is stabilized by a network of ligaments and muscles that also limit its motion. The normal sacroiliac joint only moves a small amount. Like any other joint in the body, the sacroiliac joint can degenerate or its supporting ligaments may be injured. And if this happens, it can cause dysfunction and pain. Common complaints when people do have sacroiliac dysfunction include pain in the lower back, pain in the hip or groin, pain in the buttocks. These symptoms are often worse with prolonged sitting and bother them at night. On occasion, these can cause a sense of instability in the leg or weakness or numbness. Sacroiliac joint dysfunction is common. Studies suggest that 15 to 50% of people with chronic low back pain may suffer from the sacroiliac joint dysfunction. Studies have suggested that up to 40% of people with back pain after a lumbar fusion may be coming from the sacroiliac joint itself. How do we figure that out? Well, a thorough history and physical exam need to be performed. This can be accomplished by meeting the patient, discussing what causes their pain, what relieves their pain, and performing certain physical exam maneuvers, testing the sacroiliac joint, as well as the lumbar spine and hip. Special tests, including the Fortin two-finger test and other provocative maneuvers, can help suggest the diagnosis, and an intra-articular sacroiliac joint injection can confirm the diagnosis. Once the diagnosis has been confirmed, there are many effective treatments for sacroiliac dysfunction. Some of these include changes in your activities, special exercises, physical therapy, medications, injections in the joint, and even radiofrequency ablation. In the minority of people that continue to have dysfunction and pain even after these conservative measures are done, there is a minimally invasive fusion option. This is a surgery using a small implant, the iFuse, that has a special triangular shape and allows for immediate stabilization of the joint and long-term fusion. The entire procedure is performed through a small incision, approximately 1 inch long, on the side of your buttock. Normally 3 implants will be used, depending on your size, and the procedure takes approximately an hour. The results of this are very successful. More than 50 published peer-reviewed articles demonstrate the safety and efficacy of the iFuse implant system. iFuse is the only sacroiliac fusion system with clinical studies demonstrating that treatment improved pain, patient function, and improved quality of life. In a randomized controlled trial, 90% of the patients were satisfied and would have the procedure again. Thank you for spending some time with me discussing the sacroiliac joint. Sacroiliac joint disorders are very common and are often an overlooked cause of lower back pain. If you feel that this may be part of your issue, I'd be happy to evaluate you in my clinic. Please call and schedule your evaluation today.